Hi, I'm Dr. Ashoojit Kaur Anand. I'm the director of Aveksha, which is a home-based primary care services at PCMH Restore Health, Bangalore. My expertise is in palliative medicine and geriatric medicine. So we reach out to people at their home who are unable to avail services at a clinic or a hospital. The symptoms of coronavirus, that is the COVID-19, the common flu, and allergy are almost similar. That is, a person starts with cough, cold, maybe a running nose, can have fever, and but most of the time the symptoms are similar in all the three, but the symptoms usually disappear in a week's time for most of the cases. So what happens is that all of us are susceptible, that is, we are prone to get common cold, cough, cold, fever, and so these symptoms persist for about a week in most of the people, that is about 80 to 90% of the people. So the 10% of the people who do get complications are among them, it's the death rate is seen only for about 1 to 3%, which has been seen over the last few months. So it's not, there's more of panic which is created among the people that anybody who gets COVID-19 is going to die. It's not like that, because this is like a common cold where it can last for about a week and then subside on its own, and that 10% might need more medications. So those who are in that 90% need to isolate themselves at home and call their family doctor, speak to them, and get to know as to what treatment is required for them to be taken while at being at home. And those who need to go to the hospital, if they have some breathing difficulty or the cough which is not getting better or fever which is not getting better, will be taken care of in the hospitals. So please call your physician and speak to them if you have any symptoms.